Welcome everyone. I'm so excited that we get to talk Myo today on a Monday. We usually love our Myo Mondays and have some nice tidbits for you. But today we really wanted to take more of an in-depth conversation and do an actual lunch and learn, because there's so much confusion and so much interest at the same time that I'm not sure which is stronger, but we will conquer everything today in the time that we have with Brittny. So welcome, Brittny. How are you? How are you doing today?
I'm doing good. How about you?
I'm doing great, and I love having you on, because not only do you walk the walk and talk the talk, but you run a really successful myofunctional therapy practice. So you are quite the businesswoman too. So I love the clinical aspect and the business aspect that you bring, and that's what we really kind of wanted to focus on today. Today's conversation is unleashing the potential and exploring the clinical and the financial opportunities of myofunctional therapy. And I think it's such a great career choice to enhance what we're already doing. It's almost just like next level. And
Mhm.
why don't you tell us a little bit, Brittny, for those who don't know you, about your journey as coming from a dental hygienist now to an oral facial myofunctional therapist, having many successful practices, actually.
Yes, thank you. So let's see. I read about myofunctional therapy for the first time in an RDH magazine. I did not get into it as most people do, where they have a family member that is suffering from an airway problem. I read about it and I just felt like I had to know more. We're always trying to figure out ways that we can help our patients. There's always those patients that are in our chair that like something just isn't adding up and you just have this gut feeling like you're missing something. So I was like, why not? I need to take it. I feel like it came at the perfect time. So I dove in 2016. I took many courses since. I opened my first practice in 2016 as well. So that's CT oral facial myology. It was just me for a while, and then we grew and we got busy. So I have about 4 other therapists on board. So I really love to talk about, like Lauren said, that business portion of it, because I feel like a lot of us as dental hygienists have more, our brains are more geared towards the science. And when it came time
Mhm.
for the business, I was like, I literally need to go to Barnes and Noble and get a book like Business 101 for Dummies, because I don't know the first thing about it. So, no reason to reinvent the wheel. I can help you along that process, give you tips and tricks, let you know what I did wrong, what I did right. And then in I believe around to that, like the years all kind of blend together. I think it was 2020. Joanne and I, my partner, I co-own a second myofunctional therapy practice in MyoAir as well. And we are a multi-therapist practice with 2 locations in Florida and New York. So I'm really excited to chat with you guys today. We are going to do a little bit of a myo introduction just because a lot of you in the group are very new to it and don't even really know much about myo, which don't feel threatened by that, because I knew nothing. I literally never even
Right.
heard the term until I read that article in my RDH magazine. And then we'll get into talking more about the business part of it, how to integrate it. And a lot of you had really, really awesome questions. So we're going to finish out the hour making sure we answer all of your burning questions.
Absolutely. And I just want to do some housekeeping items, that we are providing one free CE of AGD PACE credit, but you do need to be in attendance for the entire program. Zoom software tracks your attendance, so there's no need for a code or a survey. And so we will basically sending you in a week or so your certificate once we have all the information gathered. So Brittny, thanks again for taking the time. I'm going to go ahead and hand it over to you, and we're looking forward to learning from you and then answering some questions.
Awesome. All right, guys, here we go. Maybe. Let's see. Okay. So I want to first talk about, because this is even confusing, like what is myofunctional therapy? What is it called? There's so many different names. Is it all the same? Are they synonymous? So typically you're probably going to hear it called more oral facial myofunctional therapy, or for short, myofunctional therapy, even though we really should have that oral facial term in front of it, because again, we are working with the muscles of the face and the mouth. Oral facial myology, again, synonymous. OMT, myo for short. Some people get it confused with myofascial therapy. It's definitely not myofascial therapy. Myofascial therapy is more of a hands-on technique. We are not very hands-on with myo. In that first appointment, that evaluation, yes, we're palpating the muscles and whatnot, looking inside the mouth. But moving forward after that, Even if we are teaching some like self-massage techniques, say for TMD, I'm really instructing the patient more so how to do it themselves. When we think about what myofunctional therapy is, so I'm going to kind of explain it two ways. I'm going to explain it the technical definition, and I'm going to explain it the way that it's easier to describe to patients. So I really like the Academy of Oral Facial Myofunctional Therapies definition, or the AOMT. And that is the neuromuscular reeducation or repatterning of the oral and facial muscles. It is a therapy that includes facial exercises, tongue exercises, behavior modification techniques to promote, and we're going to talk about what this is, but optimal tongue position, improved breathing, chewing, and swallowing patterns. Essentially, what we're really trying to do is create that harmonious balance in the oral facial muscles. So really working on removing unintentional pressure that is on those dental structures. Now, when you say neuromuscular education to patients, they're like, what? So a couple ways you can say this. A lot of myofunctional therapists do use the term, it's like physical therapy for your mouth. I technically don't like to use that term just because I then feel like I'm practicing out of my scope. So you can explain it kind of like having a personal trainer for the muscles, for your oral facial muscles. When you explain it like a personal trainer, though, the next question is typically like, do your patients have to do these exercises for the rest of their life? And the answer is no. And the reason for that is, remember, it's neuromuscular reeducation. So what we're doing is we're recarving, or actually creating, new neural pathways between the brain and the muscles. And that's why it's sustainable. Okay. So we're creating new habits. Our goals for myofunctional therapy are establishing dominant nasal breathing. Now, this is all day and all night. We can't be nasal breathers during the day, but mouth breathe at night, okay? Same thing with lip seal, all day and all night. We want to create a palatal tongue rest position, and I'm going to show you a photo of just how much of that tongue should be up there all day and all night. We want to work on developing a bilateral alternating mastication pattern. Now, this is very important, okay? Chewing is so important for the growth and development, okay? When we chew on the right side, it's going to stimulate the mandible to grow on the right side and the maxilla to grow on the left. And then opposite, when we chew on the left side, it's going to stimulate the mandible to grow on the left and the maxilla to grow on the right. So we have to make sure we have that bilateral alternating pattern. Also keep in mind that it's typically like those first 5 chews of your food that are really going to be the most powerful. So you also want to make sure that you're alternating the side that you actually start chewing on as well. We're working on optimizing swallowing patterns with a back teeth together swallow. The only time that your back teeth, I quiz my patients all the time on this, the only time your back teeth should ever touch is when we swallow. Otherwise, we want to have about 2 to 3 millimeters between those back teeth, which is called our dental freeway space. We don't want to have less than that because we don't want to be clenching. We also don't want to have more than that 3 millimeter dental freeway space. That can also cause TMJD issues. We also talk a lot about noxious oral habits, and this is all ages, guys. Don't just think like if you're working with an adult, you shouldn't ask about thumb sucking, finger sucking. Like, you'd be surprised. There are some adults out there that are still doing that. But we're also talking pacifier use, extended sippy cup use, nail biting, hair biting, cheek biting, lip biting, literally anything, any kind of noxious oral habit that's going to displace these muscles intraorally. We also talk a lot about nasal hygiene. So the way I like to explain it to my families is we brush our teeth every day, right? So we don't get cavities. We don't just choose to not brush our teeth if we don't have a high caries risk. We also don't want to have bad breath. We take showers every day so we don't smell. So we're doing these hygienic things preventatively. Nasal hygiene should be done the same way, preventatively. You don't want to wait till your allergies flare up. You don't want to wait till you have a cold. It's something that you should be doing every day. So these are just some of my favorite products. If you guys want to snap a picture of them, the X-Clear nasal spray, it's an holistic spray. It's just saline with xylitol in it. The Air nasal gel is a saline nasal gel. Some kiddos, don't really love the idea of using a nasal spray, although once they get in their program, we usually can convince them otherwise. But say, they're a kiddo that's going to be outside a lot and, they have bad allergies and whatnot. Like, I'll tell mom or dad to just kind of line their nasal cavity. And then these 2 items down here, these are aromatherapy inhalers. Lip tape. Lip tape is a very controversial topic in the myofunctional therapy world. There are some myofunctional therapists that recommend it, some myofunctional therapists that do not. I can tell you I am on the side of recommending it. However, there are stipulations. I am not going to recommend it to a child without an ENT evaluation to make sure that their nasal airway is cleared. Because yes, we are not like in this photo where it's around the lips. There are other tapes where it's actually over the lips. I don't personally recommend those for children. I try to stick with either this myotape, which you can buy on myotape.com. I also like to use just kinesiology tape where I teach the family how to tape around the lips for children. For adults, they have to be able to breathe through their nose very well for 3 minutes. So we do a 3-minute nasal breathing test. And again, I'm not recommending like the hostage tape or anything that is like literally duct tape over the mouth. Even this little strip here has this little opening. If there is any concern about any kind of obstruction though, it is not something I would recommend. Mute nasal dilators. Nasal dilators are also really great to recommend to your patients. This is just one of the many brands out there, and that can just help to dilate those airways. So I want you all to take a second. I would like for you to breathe in through your nose and out through your nose. And as you're breathing, I want you to think, where do you feel your tongue resting inside your mouth? If you answered in the roof of your mouth, very good. We do not want it in the middle of our mouth. We do not want it in the bottom of our mouth. But there is also a particular location in the top of the mouth that we want it. We don't ever want our tongue pressing against our teeth. So when we think about where the tip of our tongue is, if you say the letter N, where the tip of your tongue goes should basically be right on that incisive papilla, on the posterior third of that incisive papilla. And the rest of the tongue, that anterior 2/3 body of the tongue, so the part that's in pink here, should be lightly suctioned in the roof of the mouth. It is only this posterior third or base of the tongue that is down, and that is really what's elevating when we're swallowing. But we want this whole tip and whole body of the tongue lightly suctioned in the roof of the mouth. Now, what you might find from patients is the tip of their tongue might be up, but that body of their tongue is down. Tongue might be all the way in the floor of their mouth, middle of their mouth, pressing against their front teeth, pressing against their posterior teeth. There's a variety of positions that the tongue can be resting in. And it would also prevent in different types of occlusion depending where that tongue is resting. And that's something that you would learn in your myofunctional therapy course. We want those lips closed. So a competent lip seal, even this, okay, that is not considered competent. We don't want any millimeter gap between those lips. We talked about the back teeth slightly apart, that 2 to 3 millimeter space. And measuring that freeway space is also something that we review in the myofunctional therapy course. And we're establishing those dominant nasal breathing patterns all day and all night. The tongue is just so important. The tongue is really a respiratory and a muscular organ. It is responsible for so many of our daily functions, for masticating, so chewing, swallowing, speaking, keeping our upper airway open, especially at night when we're sleeping. It's a huge player in optimal craniofacial growth and development. It's really going to help drive that growth. When we talk about oral facial myofunctional disorders, and we're just going to call them OMDs because that's just a mouthful, they involve dysfunction, any really dysfunction of the jaw, the tongue, and or the lips. So it could be a combination. So parafunctional habits like clenching and grinding, those non-nutritive sucking behaviors that we discussed. Incompetent lip seal, that forward or low tongue rest position, a tongue thrust or a reverse swallowing pattern, poor nasal breathing or mouth breathing. Oh my gosh, I'm sorry guys with my screen. I talk with my hands so much because I'm Italian and I don't know how to turn off these gestures. But one of my patients taught me something really cool. Like if you hold the heart sign, I'm sorry, I just have to show you this. Oh, see, yay. There's so many cool ones. But anyways, moving on. I apologize if anything else pops up on my screen. Chewing disorders are also considered an OMD. So not masticating that food appropriately, unilateral food chewing, and the inability to form a bolus. Again, this is all stuff that we will review in the course, but a bolus is that basically cohesive unit of food that we should be gathering our food into right before we swallow on that mid to back portion of our tongue. Now, what might we see when patients come in and they exhibit these incorrect oral muscle patterns? We might have feeding issues, and this can range from infancy all the way up to, 80, 90, 100 years old. Now, I don't treat infants, but I do take a very detailed medical history to know if they had any feeding issues in infancy. Okay. So issues with breastfeeding or issues with bottle feeding as we're a little bit older, picky eating, grazers, packing food like chipmunks, only wanting to have softer foods, not really being able to chew harder foods. Bruxism or TMD, the tongue really plays a huge role in stabilizing that joint. So most of the TMD patients that we end up seeing do have incorrect oral rest posture and typically poor swallowing patterns. Sleep disordered breathing, we're talking about that umbrella term. So mouth breathing, snoring, upper airway resistance, full-blown sleep apnea. We might see some digestion issues or GERD or reflux or, IBS type symptoms, constipation. Think about it. Digestion begins in your mouth. If we are dysfunctional up here, how are we ever going to really be able to have proper digestion? Or think about when we talk about our parasympathetic versus sympathetic nervous systems. And if we are in a sympathetic overdrive because we're a mouth breather, that is our fight or flight nervous system. So how does that sound like that's going to do for our digestion, right? We want to be in our rest and digest mode, which is our parasympathetic nervous system. Postural issues, oftentimes we're seeing that forward head posture as an adaptation to help us breathe better. Recurrent ear, nose, and throat infections, periodontal disease, poor oral health. We know what mouth breathing can do to the gingiva and to the periodontium. Also think about what clenching and grinding is going to do to that periodontium. Insufficient craniofacial development, so having narrow jaws, recessed jaws, not adequate growth in that forward direction, that anterior to posterior direction. We might see some speech problems. So what age do we start myo? So a full myofunctional therapy program is going to be about 5 and above. We do offer a mini myo for that 3, 4, 5-year-old age range. It's really going to depend, children are so different, their maturity level, their behavior. But typically speaking, 5 and above would be a full myo program. Now, I wanted to have this slide on here because some of you might already be practicing in practices that have a heavy focus on sleep apnea. There should be a myofunctional therapist in every dental sleep practice, even a regular sleep practice, because there is such a role for myofunctional therapy in the management of obstructive sleep apnea. We're working on strengthening those muscles that collapse, improving muscle tone and control. So improving tone and control to that the pharyngeal muscles, the soft palate area. We're working on nasal breathing. We're correcting oral habits. Doing myofunctional therapy can actually help increase the efficiency and efficacy of oral appliance therapy and or CPAP therapy. There are studies out there that show that myofunctional therapy can decrease the AHI by 50% in adults and 62% in children. That study was done in 2015 by Dr. Camacho. And we're also helping to facilitate orthodontic treatment. Most of these patients that have obstructive sleep apnea, the reason they have obstructive sleep apnea is underdevelopment of the jaws. Oftentimes they are needing to seek an orthodontist or an airway dentist that does some expansion. So as we said, the tongue is really that primary architect of the maxilla and mandible. We need proper forces from the tongue to develop that growth. So not only do we need forces from the tongue transversely, but we also need forces from the tongue anteriorly. So we get that transverse growth and we have that forward growth. When the tongue is just resting low in the bottom of the mouth, we're not really getting any benefits from having that correct tongue posture, right? So that's where we're having those unintentional pressures or balances in those oral facial muscles that we talked about. So what happens is the cheeks win. The cheeks are going to cave in that dental arch because it doesn't have that balancing pressure from the tongue up there. We are born obligate nasal breathers. So if we are a mouth breather, something along the way went wrong. And as a myofunctional therapist, I feel like we're kind of like detectives to kind of figure out like where this dysfunction may have started. And it could be multifactorial. It could be due to a tongue tie, allergies, enlarged tonsils, adenoids, turbinates, etc. Our tongue and our lips are our body's own orthodontic or retention system. So myofunctional therapy is not new. Myofunctional therapy dates back to over a century ago with Dr. Edward Engel, who we know we classify our occlusion that way. And he really gave credit to what all of these oral facial muscles do on retention. So much so that he said that if you do not correct that soft tissue dysfunction, we will see relapse. Now, I'm not going to tell anybody that they should never wear the retainer because I'm not an orthodontist. But if our oral facial muscles are functioning as they should, there should be no reason that we're seeing this orthodontic relapse. And that's why we have to address structure and function together. We can't ever address one without the other, or we are going to see these cases of relapse. When we talk about the root cause of sleep disordered breathing, it's the underdevelopment of those jaws. So I'd like for you to suction your tongue to the roof of your mouth, like so. And I want you to try to breathe through your mouth. And you'll see that if your tongue is suctioned up in the roof of the mouth like you should, you are not able to breathe through your mouth. It is when that tongue posture drops that we become mouth breathers. And look at the impact that it has on that craniofacial development. This photo up here is the facial profile of a nasal breather. Down here, we have the facial profile of a mouth breather. So we have this open mouth posture for mouth breathing. So what's going to happen? This jaw is going to swing back. This face is going to grow long and narrow versus wide and forward. You can see we would have tired eyes under here because we're probably not sleeping well. We don't have as good facial definition in our cheeks or in our jawline. You can even see sometimes this little bump on our nose forms. And oftentimes, as that maxillary arch or that palatal vault narrows, it can, as it rises, I should say, really, it can actually deviate that septum. So oftentimes we're seeing some kind of septal deviation going on in these patients. Not all the time, but often. Okay, so getting into the business of myo, the how, the who, the when, the why. Again, we're going to touch on this very briefly, but it is something that we deep dive in our introductory to myofunctional therapy course so that you finish that course feeling ready to take action and to really start practicing. So these are things for you to think about before you take your first course. Is this something you want to offer in office? Do you want to be the myofunctional therapist in the current dental practice that you're in? Or do you want to have a private practice where patients are referring you, or I'm sorry, providers are referring you patients? Perhaps you even want a combination of the two. And that's something that you, again, contracts and all of that come into place. But you want to think about, what do you want to be responsible for essentially? If you're an employee or a 1099, you're typically not responsible for billing, scheduling, marketing, networking, all of that. If you want to have your own myo practice, you are all of this until you can establish your practice enough where you can kind of outsource that information. Okay. So, all of the duties that come along with having a myofunctional therapy practice. So you'd be that biller, you'd be, making sure you're getting paid on time. You'd be doing the scheduling, the phone calls, going out and doing lunch and learns and making new connections so that you have that steady referral basis. And we talk about the importance of networking and how to properly network in order to get your name out there and really get, providers starting to refer to you. You also can have a private practice where you have employees or 1099s. So again, there's different ways to go about this. If you're doing this in your current office, or you're allowed to screen patients for myo and refer them to your private practice, basically what the key steps would be are you're assessing, you're doing that diagnosis and treatment planning, you are educating the patients, right? So a lot of them don't have any idea why they need to see you. So once you do that evaluation, you come up with your treatment plan, you have to educate the patient, have them understand why do they need this myofunctional therapy? Why is it so important? We're obviously implementing the therapy. And that typically lasts about 4 to 6 months of myofunctional therapy. After that, you're continuing to monitor that patient's progress. And, post finishing the program, you don't just want to bye, sayonara. You're following up on them. So I have about a year follow-up on my patients just to ensure retention and everything is going well. Collaboration with other providers. You are never going to be the only person that these patients see. Myofunctional therapy is an adjunctive therapy. So again, that patient education part really comes into play because we can be limited with what progress we can make if these families are not seeking X, Y, and Z referral that we give them. And then you have that maintenance and follow-up. So why should you incorporate myofunctional therapy into your professional toolbox? First of all, diversification. There's not many of us that do this. So being able to offer these services in an area where it is most likely limited, or if not, again, you have to find your value, your unique value, and what you're bringing to the table that maybe other myofunctional therapists that are already in your area aren't doing or aren't offering. It allows you to provide that comprehensive specialty care. Comprehensive treatment is huge. Specialty care. You are a specialist, okay? You are on that same level as the ENT that you're referring to, the tongue release provider you're referring to, the airway dentist. You are just as important. And when you start to network, I want you guys to remember this, that you are a specialist. So don't feel like the small dog because you're not. Patient demand, there is a growing demand for this. There are families finding myofunctional therapists online. James Nestor's book, Breath, really brought to light the importance of all of this. Tooth Pillow is really reaching the general population. A lot of moms that are really understanding or starting to see now these signs and symptoms that their kids are experiencing. And again, they're Googling myofunctional therapist in my area. Improved outcomes. So improved outcomes in your therapies, like even as a dental hygienist, improve outcomes. Think about your periodontal patients, right? I remember as a hygienist, there would be perio patients that would come in routinely for their 3-month perio maintenance. They weren't smoking, they weren't drinking, they were doing all of the hygiene recommendations I made, and their disease was still active. I didn't know any better then. I never screened them for airway. I didn't even know what that meant. I had no idea that I played a role in obstructive sleep apnea and helping to assess that and get patients to the right providers. Your orthodontic stability, you will play a huge role in that. Increase competitive advantage and collaborative care, making connections with other healthcare professionals. It is something so exciting about becoming a myofunctional therapist to see your network grow. It is very fun and it's very rewarding. And again, as you're making these connections, not only are you going to be referring patients to them, but it's a two-way street. And that is really what you want to focus on. So we're going to have a couple of our past students hop on to share with us their experience, but I wanted to just give you guys a second to screenshot this. There's the QR code there. If you want to learn more about our course, our next course is going to be starting June 5th. And the way that that course works is when you register, you will get access to about 9.5 hours of pre-learned content. And then starting June 5th, every Wednesday, a lecture is released for your own viewing. You can watch it in your own time. You can rewind, take notes, do everything you want to do. And then that Monday, we meet live for a virtual Q&A, which adds so much depth to the course. And those are all recorded as well in case you can't make it. I know it's summertime and things get a little hectic for people. And if you have any questions about the course, please don't hesitate to reach out to me. All right, let me stop sharing.
Hey, terrific. So we have Melanie Decker and Erin Simpson. You guys want to come off of mute and come on camera so we can see your smiling faces?
Hi,
Hello.
There we go.
ladies.
Yay. Hi, guys.
Oh, I look
Thank
like I don't.
I'm so excited to see you both again. I miss your faces.
I miss the Monday meetings too.
I
I
know
wish we
they're
still
so
had them
fun.
moving forward.
I know. But I appreciate you guys coming on. If you want to each take a turn and just kind of share your experience that you had in the AHS School of Myo intro course, your thoughts on it. anything that you'd like to share with others.
Go ahead, Erin.
All right. Well, I took the course, I think the last session, right? Or is there one between?
We're in one right now, so the last one.
Okay, the last session. The pre-learns, when I first got them, I was like, oh God, how am I going to do this with a 3-year-old? This is so much information. But I did it. And then once the course started and we started doing the Monday meetings, everything kind of just rolled together. So every week things made a little more sense. And then by the end, it all made sense. And since I've finished, I've seen 6 patients now. So it's every
Wow.
patient feels a little bit better.
Oh,
So
I'm
it's
so
overwhelming
excited
to
for you.
start, but totally worth it.
Awesome.
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 Yeah.
Thank you for sharing.
Can you elaborate a little bit on that, Erin? Because we all, I just remember even coming out of dental hygiene school, and that first patient is kind of terrifying. So you want to just share with it what that was like for you? Are you a registered dental hygienist? Are you a speech language pathologist? What is your background?
I'm a registered dental hygienist, and it was exactly like coming out of hygiene school. I
Right.
actually was talking to one of the other girls who took the course. We've kind of been messaging back and forth since we took it. And we were saying that when we first started as hygienists, we had to remind ourselves, like, I know what I'm doing. I know how to scale, and had a little bit of imposter syndrome, but you just do it. It's just like when you're at a hygiene school, and then you just start, and then it starts to feel better.
Yes. And just
Wonderful.
like I said, right? Every patient you see gets a little bit better. And the biggest thing is like, think of, again, just relating it to hygiene school. I mean, we are so prepared by the time we're finished with hygiene school. Nobody understands what we go through to be registered dental hygienists. But you always just still feel nervous because it's something new. But if you don't just take that plunge and start seeing patients, because that's how you're going to become more comfortable and confident, you have to do it. So I'm so excited for you and proud of you that you did that.
Thanks.
You're
Awesome.
welcome.
Thank you. And Melanie, you want to share your experience?
Yeah, so I'm actually in the group that's finishing up right now.
Okay.
So you said it perfectly, how like each week it makes more and more sense, right? Like at the beginning, and the pre-learns were amazing. I feel like even just doing that, I was like, oh, okay, like I want to do this. I'm ready to do this. But yeah, then as you did like week 1, week 2, and it just kind of like all links together. And Brittany, you mentioned the Monday night Q&As I've been really fortunate. When we first started, I was nervous about like, am I going to be able to be live? Like am glad that they're recorded, and that's a great resource, but I really wanted to be able to make all of them. And I'm really glad so far that I've been able to do that. And it really has like just, learning from one another. We have different providers in the groups, which I feel like really adds to our particular like group that's going through right now. So I'm also a dental hygienist. I don't know if I said that. So yeah.
Wonderful.
This group right now is so great. We have an OT, we have a dentist in there. I think there's a speechy in there. I can't think off the top of my head right now, right? So it's really awesome just to hear everybody's perspective. And those Q&As, like I said, they are the value of the course alone because it just helps connect everything. So again, if you're nervous that you're not going to be able to make it that night, that's okay. You would just message me your questions. I'd make sure to get those questions answered in that Q&A. And then you guys have access to the lectures, to the Q&As, through Dropbox for, literally as long as Dropbox is a business, which I'm sure it is.
Yes. Don't even say that.
Some of us made the Q&As with like our kids in the background. So it's super easy to make them.
Yeah.
You mute yourself, you still get to hear it, but like your toddler's playing beside you.
Yeah. Yep. For sure.
Wonderful. Wonderful. Well, thank you so much for sharing that. And also, Brittany, you also offer support with the Facebook private group that after for the Myo alumni, as well as you're part of our quarterly town hall meetings and also with our airway dentist faculty. So Dr. Ben Moralia, Dr. Kevin Boyd, Dr. Michael Gelb. So you really kind of be entrenched with the whole AHS family. So welcome aboard, guys. We're so happy to have you. And thank you for being really part of this movement, because so many people need this help. So we're so thrilled that you're part of our journey as well. So thanks for taking the time.
Yeah, for sure. Thanks.
Was there anything else that you wanted to say that perhaps we didn't think about? Or someone who's maybe on the fence of taking the leap, what would be your one kind of key point for them to take away?
I would say if you're hesitant because of the cost, that the return on investment once you start doing it is very fast. And that Brittany's awesome. So take the course.
Thank you.
Thank you.
All right, Melanie, I'm going to put you on the spot. What is your one key takeaway for those
Yeah.
on the fence?
I mean, I feel like I'm still in it, right? So I haven't been able to see that return on investment, but I already feel good about the investment. I think Brittany used the term of like in your tool belt, like having another, especially as a dental hygienist, sometimes that can be hard on your body. Sometimes you can have injury or, what have you. For me personally, I'm a military spouse, so we move quite frequently, and that involves a lot of relicensing. And depending on how long we're going to be there, sometimes it's just almost not worth the investment in that, in getting licensed. Like right now, we don't even live in America, so that's the whole thing. But anyway, so for me, it's just another thing in my tool belt and something I can take with me. And whether I am in private practice doing my own thing online, it's just, yeah, I would recommend it for sure.
Great. Thanks, guys. We really appreciate it. There are just some questions in the Q&A part here. Do you have a module for myofunctional therapists that graduated back in 2017 and need help with the business side? So I'm going to go ahead and share my screen, Brittany, because we have some of your other courses on here. And we do have some specials. So we are offering our summer semester special. This goes to all our courses, including the Myo courses. So we do have the summer 10 code for the course coming up on June 5th, and also the business course. Brittany, you want to tell us a little bit about how the business course works for those who already are myofunctional therapists?
Yeah, absolutely. So the way that we have it structured is you come in on week 3 of our general 8-week course, which I wanted to do it that way because I feel like if there's one thing about taking a myofunctional therapy course from different instructors is it's always great to learn different exercises. So we have you come in on that exercise week. Actually, you end up coming in on the tethered oral tissues week is week 3. Week 4 is our myofunctional therapy exercises. But learning our protocols for tethered oral tissues, pre-release, post-release, the myofunctional therapy exercises. So you're still getting a little bit of clinical information on top of deciding how you want to start your business. We talk about the different options, LLC, sole proprietorship, S Corp, and so forth, the networking aspect, how to get your name out there, different things that you can do, who you want to network with, at what point you want to network with these providers. We go through, what you'll need to start your private practice, like literal like supplies, clinical supplies, how to get your business off and running. We really cover pretty much everything that you would need to be able to start your company by the end. And you would still be able to do, so the final week is still going to be that case study presentation. So you'd still be able to participate in that where you were able to present a case that you've been working on. So again, if you have any more specific business related questions, feel free to reach out, but we are going to cover all of that in that 6-week course.
Wonderful. And you also have a shadowing opportunity. You want to talk a little bit about that before we get into
Yeah. So, I know for me, like I wanted to shadow somebody as soon as I was done with myofunctional therapy, because to see it like in action and how somebody does it, I think can be very helpful. So we have 2 different options. You are totally welcome to come on down to Connecticut and stay with me and spend, a day or 2 in the practice with us and my other therapists and seeing how our day-to-day processes work, how we interact with patients. For those of you that maybe it's just not feasible for you to make the trip down to Connecticut, I am also offering it virtually. There are a lot of myofunctional therapists that end up doing virtual-based practices. So what we would have you do is just log on with our patients. We'd have you keep your camera off, but you're still able to see the way we run our evals and our therapy sessions online. And even with that, we'll still have time, like one-on-one time, to talk about really anything that I can help you with in your myo process or journey.
Wonderful. And any questions with that, you can email info@airwayhealthsolutions.com and we can give you more information, or we'll put in the chat our link directly to learn more about the Myo. Just some clinical questions here, Brittany. Do you start Myo before sleep appliance therapy and tongue tie release?
So you absolutely positively want to start it before a tongue tie release. It's absolutely necessary. Even those patients that are very anteriorly tied, I still like to do about 1 or 2 sessions before. But generally speaking, for like a mid-tongue restriction or posterior tie, I'm working with those patients for about 4 to 8 weeks prior to them having that evaluation. As far as oral appliance therapy, yeah, I think if you can get started before that process, that'd be awesome. But there's nothing wrong with a patient already coming to you that's in oral appliance therapy and then you starting that program. But for tongue tie, like it is an absolute necessity that you see them before that release.
Wonderful. And talk a little bit about the IAOM being an affiliate course and how that works, because everyone always asks, do I need to get certified? How do I get certified? What does certified mean? Tell us a little bit about that process of becoming a COM and what that is.
Absolutely. So a COM or COM is a certified oral facial myologist. So let me start with this. You don't have to be certified to practice myofunctional therapy. I actually didn't become certified for 3.5 years when I became a myofunctional therapist. It didn't hinder my business by any means, but I do think that, in this growing field, it's important to have some kind of, institute behind us or some kind of commonality between all of us, because the problem that's happening right now is it is not the way that we get certified is not how we get our RDH license. There's no one governing body. There's no, state board or anything like that. So there are so many other certifications out there. There's a QOM, there's a COMT, there's a AOMTC, there's a CMT. And I just feel like if we all just kind of came together and we had this one designation, it would help our field grow. And the IAOM, so the International Association of Oral Facial Myology, has been around the longest. The COM certification has been around the longest. So what we did, again, we are now an affiliate with the IOM. So after you finish our course, you are able to apply for that certification process. Airway Health Solutions, we don't have anything to do with that certification process. What happens is after the course ends, you get a certificate of completion for your 28 hours, which you need to then apply for the certification process. And we do talk about that through the course, what that kind of consists of. And they have a lot of information on their website. And it is a little bit more of a lengthier process. You have to, start seeing patients and have somebody watch you and assess the way that you're providing therapy. But it's a really comprehensive certification, and I highly recommend going about it after you finish the course.
Yeah, we're happy to be partnering with them. Let's talk a little bit about the mini myology course and why you thought this was important. Actually, Kevin Boyd was really insistent that we had this to treat under 6, but I know this is what you do in your practice. So share a little bit about the mini myology course and who would that be for, number 1, and number 2, what is it all about?
So any myofunctional therapist that wants to treat that younger age population that you feel a little uncomfortable doing so, it's going to look a little bit different, right? They're 3, 4, 5-year-olds and they're running around and they can't sit still. And the way that you instruct the exercises, the way you talk with them, the way you play with them is really all going to, make a difference in your success. So just really helping you give you those strategies to be able to start treating this population with confidence, what that assessment would look like, what that evaluation would look like. Treatment planning is going to be very different for this age population as well. But as Dr. Boyd, again, was very insistent. He's a pediatric dentist, for any of you that don't know, a trailblazer in this field. We want to get to these kids as soon as we can. So why would we wait when we can start making an impact now? So I thought, again, just there's so many providers that would reach out to me saying I just don't feel comfortable treating this age group. What do I do? How do I, how am I giving them their exercises? And again, I just wanted to provide a more comprehensive course for you guys to start feeling comfortable treating that age group. So again, 3, 4, 5, 6-year-olds.
Yeah, and this is also available on demand now, and we are having that summer special. I know someone asked for that code again. So this applies to that course to be 20% off, and we're running this through Labor Day. So we're going to kick off with Memorial Day. I know that people get a little, I'm going to say more relaxed in the summer. So we wanted to give you the opportunity to have learning at a longer pace. So we are offering this course for an extended time at 20% as well. Another question is, can you have a practice without a dentist, unlike practicing as a hygienist?
Yes, so we talk a lot about this in the course as well. When you're practicing myofunctional therapy, you are not practicing as a registered dental hygienist. Picture it as two separate hats. You either have one on or you have one off. Even if you are practicing in your actual dental practice, you still want it to be that way. You want to treat them as separate entities. So in short, to answer your question, yes, I have two private myofunctional therapy practices, and there is not a dentist that is overseeing us. So it is very different from us as hygienists because we generally have to practice under general or direct supervision. But as a myofunctional therapist, you are able to have your own private practice. You'd be working collaboratively with other dentists, but they wouldn't be overseeing you.
And can you, I know you're going to go in this in greater detail in the course, but can you talk a little bit about billing for myo, or is it a cash practice?
Yes. So I highly recommend doing fee for service. There are not any myofunctional therapy codes that exist. So I'm going to provide you guys with a bunch of codes that you can use on super bills. I'm going to teach you guys how to make a super bill. A super bill is essentially a document that has diagnostic codes, procedure codes, confirmation that the patient made payment to you. They would send that into their insurance company. And if the insurance is going to reimburse them, they'll reimburse them directly. But you're not going to be participating with any insurance, especially in private practice as a hygienist. We just literally can't do that. We can't bill insurance as RDHs. So we are limited in that aspect, but typically most myofunctional therapy practices are fee for service. Some offer super bills, some don't. I have not had any issues with patients really turning away because we don't accept insurance. You can set up different payment plans. We'll talk about that, health savings accounts, and so forth.
Wonderful. Is the on-demand course eligible for IAOM? And is the difference between the live and demand, the Q&A, is the content the same?
Great question, Megan. So the on-demand course on its own, unfortunately, is not eligible for the IOM because the on-demand course is only 20 hours and you need 28 hours to be able to apply for your COM. However, we are going to be having I don't know what you want to call it, like a merger course or a bridge course.
Enhancement course, enrichment course.
Enhancement, yes. That's going to give you those added, 8 hours that you need. But the actual course content, the didactic information is the same in the on-demand and the live. The only difference is, yes, the Q&As you do not get access to in the on-demand. And I would just keep in mind, again, listening to the ladies, the Q&As are so helpful. I'm not trying to steer you away from the on-demand course, but if this is your first Myo course, oftentimes what happens, we've had this happen with two students already. They did the on-demand course and then they asked to be part of the Q&As. So just consider that.
And we can also, we want to try and make this as workable for everybody as possible. That's something that we may be able to do is to, if you wanted to do it on demand for now, and then we can have perhaps if this summer doesn't work for you, you can join a future Q&A session. So, we try to be as flexible as we can. Everyone has a different situation. So just shoot us an email and we'll try to work with you the best we can. Can you practice virtually for patients all over the nation?
Yes. Yep. There is nothing that limits us from doing that.
And where are you seeing patients? What's the appointment look like?
Yep. So I see patients in office and virtually. We see virtual patients globally around the world. The appointment, what it looks like, it's typically a 30-minute session. You're, reviewing any updates since you last saw them. Did they see any other providers? You're reviewing old exercises, giving or prescribing new exercises, talking about oral habits and, nasal hygiene and things like that.
Great.
And we're going to go over all this in the course.
And we have an RDH in Ontario. How much can I charge my dental clinic when it starts to work with an OMT? Because I'm thinking to assess my dental clients to suggest them the new approach. Let me just read that again. Maybe you want to take a look at the question
Yeah.
and
How much I can charge my dental clinic when I start to work with. So, it depends how you're going to work with your clinic. So if you're going to be like renting space from them per se and seeing patients in their office, you would pay them a rent and then you'd have your private practice in there. Some dentists do ask for like a commission. So there's all different ways to work that. But as far as like billing for the actual therapy program, what I usually suggest is calling local speech therapy offices around you and see what they charge for a session. It's typically going to be about the same. Obviously, it depends where you live, across the United States or internationally, wherever you are. So I would do that first. And then I'd figure out, really what it is that you want as an RDH being a myofunctional therapist. Do you want to pay rent? Do you want to pay your dental office a commission? Try to figure out what's best for you and present that to them.
great. And if they need help with a virtual practice, do you have something for that in your shadowing to run a virtual practice?
Yeah. So like I said, our shadowing course that we have, it's not just in person. You can do it virtually. So you can see the way that we evaluate patients virtually, the way we treat patients virtually. And then throughout that day, we will have one-on-one time for you to ask me any questions, anything that I can help you with, starting that virtual practice. The other thing that you can consider is we do have a group mentorship where we meet once a month. It's a general mentorship. So pretty much you come to that talking about whatever it is you have questions on. If it's the business portion, if it's virtual therapy, if it's about a case study. And I like the fact that it's a group because again, you learn from others, and it just helps to expand, your knowledge.
Does the intro course cover all necessary info to pass the certification course, asking as an SLP?
Yes. Yep, it absolutely does. Like I said, the certification course, there's going to be a multiple choice part to it. I don't know if it's 100 questions or whatnot. There's going to be a lot of reading that you'll have to do. They supply the different studies and stuff like that you have to review. And then the clinical part of it, I mean, yeah, you're definitely going to be ready, to be able to pass that once you take the course.
Let's clarify on these two, the 8-week course and the 6-week business course, because the question is, so to be all in and certified and ready to practice, you would do the first 2 courses, not the on-demand?
Okay, so don't get so these courses, the 8-week course, if you are new to myofunctional therapy, the 8-week course is for you. The 6-week business course is only for people that have already taken a myofunctional therapy course. So if you're looking to start and get certified with the IAOM, you want to take the 8-week intro course because that's going to give you your full 28 hours that you need to apply for that certification process. The on-demand option, like Lauren said, if you wanted to do the on-demand part where it's just more, self-learning or self-paced learning and then do the Q&As at another point, you can do that. But it's still going to cost the same, if that makes sense.
Right. And there were some questions that people had submitted earlier. And what can a myofunctional therapist work independently in their own practice? Is that based on state?
Can a myofunctional therapist have their own private practice?
Yeah. Mm-hmm.
Yep. As of the way that it exists right now, yes. Any RDH in any state in the United States can have their own private practice.
Right. And let me see if there's anyone. Someone wants help finding an airway focused orthodontist in Utah for my daughter. I'm going to just also suggest that you kind of look for probably more of an airway dentist because there are many more airway general dentists that do airway orthodontics than orthodontists. So you may want to look at our locator, which is airwayhealthsolutions.com/locator. So that may be helpful for you. And let's see if there's any more questions here. How much would be a reasonable amount to work on commissions with your dentist? I know you're going to get into specifics.
Yeah, I mean, typically, commission in the dental field is about 35%. I would say probably up to 40%. with maybe, putting in some monthly bonuses if you reach certain goals. It's really going to depend again on how much you're going to be doing. Like if you're just going to be providing the myofunctional therapy, then that 35 to 40% is accurate. If you're going to be doing the billing, the scheduling, networking, marketing, any other extra duties, then obviously you want to also account for all the other soft hours that you're going to be putting in.
This is an interesting question. So looking into becoming a myofunctional therapist, I'm having burnout from clinical, which is very common, but still need to keep a good portion of my income. Would this be lucrative and only work 1 to 2 clinical days a week when I've been working 4.5 days a week?
Yeah, so myofunctional therapy can be extremely lucrative. I mean, personally speaking, I left clinical hygiene in 2020 completely. I was only like a day a week at that point, but I've tripled my hygiene income. Now, I'm not going to say that that's like rainbows and butterflies. It does take a lot of hard work to get to that point and building your practice. But once you have an established practice, there should be no reason that you can't more than replace your dental income. Even speaking as if you're going to be a myofunctional therapist in your dental practice, typically, let's say you're charging, I'm bad at math, so let me pull up my calculator. Let's say you're charging $150 for a 30-minute session, and let's say you're getting 40% of that. That's going to be $60 that you're making in 30 minutes. So essentially $120 an hour. Again, it's going to vary depending where you live, but that is more than typical hygiene salary or hygiene hourly wage.
Okay. Clarifying the question about the IOAM certification, is the case review you mentioned the IAOM test?
Okay, very great question. So in your 8-week course with me, the 8th week, you all present a case study, or I should say the first 12 registrants of the course are able to present a case study. The reason I like this, the reason that I included it is I wish that I had a mentor by my side as I started seeing my first patient. So you're going to leave the course, already have started to treat, evaluate, assess, diagnose, treatment plan your first patient. So it just makes you more comfortable as you start to see patients when you're not in the course any longer. But that is separate from your IOM certification. When you do your on-site clinical portion, they're going to send you a list of everything, but essentially you have to see different patients at different points in their program. So like they're going to want to see a new patient. They're going to want to see a patient in progress. They're going to want to see a patient that you've already finished. I think they want to see like a habit elimination patient. There's different criteria that you have for the IOM certification. And you can find all of that information on the IAOM website. If you go to the COM, they have all that on there.
Wonderful. And is the mini myo program just new exercises, or does it go more in depth on how to deal with kids or address kids who are neurodivergent?
So there's more myofunctional therapy exercises, different ways to approach those myofunctional therapy exercises. And yes, we go into ways of how like that therapy session will differ and how to actually like interact and engage and keep those patients, somewhat engaged they're not going to be engaged for the whole 30 minutes, but at least for, 15 to 20 minutes so you can get accomplished what you need to. So we're going to provide tools and strategies, again, how you just kind of treat this age differently than if you were doing myofunctional therapy with an older child or adult.
And there was just another question about the locator. Also, when you graduate from the Myo program, we are now having our Myo locator, which will be on our airway dentist locator. So you can go and find like-minded dentists who've taken Dr. Morales, who's our chief clinical officer for our coursework. So we're in line with his work, which also leads to another question is from Therese. She said, I've heard of MyoBrace appliances. Do you discuss appliance therapy in the course, and is it a necessary appliance for all or case by case?
Yeah, so there's actually in your pre-learn content, there's going to be a little module on different appliances that you'll see as a myofunctional therapist. I don't dive into every single one in depth because there's so many different ones, but just so you guys are familiar with the ones that exist out there, and then whichever ones your providers end up using are the ones that you should definitely learn the ins and outs of. And we end up talking about a lot of appliances like through the Q&As as well. So you'll definitely learn about all of that.
And does the on-demand course also discuss the business aspects?
Yes, it does.
Okay. How did you go about getting other providers on board to refer patients to you? Did you have a lot to do of work before starting your practice, going out and meeting providers?
Yeah, I mean, I honestly would start looking now for people that you can network with. Like, start making yourself a list of pediatric dentists, general dentists, orthodontists, ENT, sleep dentists in your area that you want to network with. As you start to take the course and you gain a little bit more knowledge of how to present, like what myofunctional therapy is, you get more comfortable talking about it. I highly, strongly encourage you to start networking while you're in the course. So that way you're armed and ready by the time you finish the course. We already have these relationships established. And we're going to talk about that in the course, how to find these people, how to find like-minded practitioners. The other thing that I wanted to say, I saw that there was a question from a dentist in here. How do I get started and incorporate this into my practice? I don't exactly know what your current situation is, but I would suggest getting your hygienist trained. So sending her to the course. I also want to say that we've had multiple dentists who've taken the course, not that they tend to be the myofunctional therapist, but so that they have a better understanding of what it is, what it entails, so they can better, assist their dental hygienist, through that. And again, having those conversations in practice as you're seeing these patients, you kind of want to have an idea of what that patient can expect once they start working with the myofunctional therapist. So dentists are more than welcome to join the course.
Wonderful. And we also have a public Facebook group that's eligible for everybody. They don't need to be our alumni. I'm going to put that in the chat, the myofunctional hygienist group, right? We can offer that for people who wanted more information or just curious.
Yeah, the myohygienist, that
Yep.
group you're talking about? Yep, absolutely.
So we'll put that link in the chat. Because then you can just learn more from other people who are curious. And Brittny, you do a wonderful job with your podcasts. I'd love to talk about that too. If you just want to learn more about airway in general, we also have archive podcasts on our Airway Health Solutions YouTube channel, as well as our website. And Brittny, where can they find your I Spy with my MyoEye podcasts?
Yes, you can find it on Apple Podcasts, Spotify, all major platforms. You can visit my social media pages. I have it linked there. Yeah, you can find it on there. And I just want to answer one last question before we wrap
Sure.
up. Somebody said, how long does it take to become a myofunctional therapist? As soon as you finish that 8-week course, you can start literally practicing that day. You do not have to wait until you're certified. Like I said, some people don't even end up getting certified. So once you finish your 8-week course, you can start seeing patients immediately after.
Wonderful. Well, I just wanted to share some upcoming courses too, if people are just more interested. We all love Susan Maples. She's also has a course which is great for dentists and hygienists and any airway healthcare provider. Actually, that's going to be August 2nd. That's going to be run virtually live. It's always great to learn more about sleep apnea. This is available on demand, and we do have the 20% off running through Labor Day. I love this course actually. It's a wonderful course just to learn more about the difference between obstructive sleep apnea, central sleep apnea, how to really have really complex conversations so you understand it in a simple way with your patients. We do have our Airway Palooza modules on demand. You'll learn a lot from this group for sure. 100% of the profits do go to the charity Children's Airway First Foundation, which I also want to give them a shout out because they have a lot of free resources. One of the questions was, how do we get our parents on board and understanding? And Brittny, you did a podcast that was geared towards patients. There are other myofunctional therapists on there, as well as other healthcare professionals that do this in a very patient-friendly way. So please take advantage of their resources at children'sairwayfirst.org. There is an upcoming ADA Children's Airway event, which I'm always excited when the ADA is behind this as well. That's going to be May 3rd through June 1st in Chicago. You will learn a lot from this team of experts, and they do have a myofunctional therapist there as well, Samantha Weaver. You can get 30% off using that code Airway24. If you haven't been to a Collaboration Cures, it's a great way to get motivated and learn more about the whole collaboration. As Brittany has said multiple times, you were not alone in this. So it's really good to see your network of colleagues that you may not even be aware that you have, our airway health colleagues. We do have an upcoming free conversation. This is going to be June 5th with Dr. James Bronson. He's the founder and CEO of the ALF Appliance. A lot of questions about that. So I always like to bring you more information. So please feel free to join us and share with your colleagues this free information. Again, there's so many appliances out there. It's really good to learn as much as you can, and why not learn for free, for sure. So that's all of my updates. Let me go ahead and stop the share. I wanted to see if anyone else. Oh, Brittany had to hop off because she is a patient. So, you know, she's a busy lady, and it all happened. It's just from taking the effort and the time to really walk the walk, talk the talk, do the learning. You have your resources here. It's a wonderful, wonderful career opportunity for everybody, and we're here to support you. If you have any questions, please feel free to email us at info@airwayhealthsolutions.com. Join our social media pages, and hopefully we'll see you guys soon. And we're happy to hear and help you. Thank you for joining us today, and thank you, Brittany, for all your time and passion. Thanks.